Anam Asghar and my student ID is S33214 and I'm a student of Certificate of Higher Education, Health and Social Care, and today I'm going to present analysis of strength and limitation of assertive communication.
Start.
Contents: background and importance, assertive communication, key features of assertive communication, strength of assertive communication, limitation of assertive communication, application in health and social care, person-centered care, teamwork and collaboration in healthcare, and conclusion. Background and importance. Communication is a fundamental skill in health and social care practice. Effective communication enhances patient safety and quality of care. Inadequate communication may result in error, misunderstanding, and damage. Assertive communication is widely used in professional healthcare settings, help balance the respect of self and other in interactions, advocates professionalism and ethical practice. Assertive communications means speaking in clear, direct, and clear way. It allows a person to share their thoughts, feelings confidently without hurting other feelings. It is different from passive communication where the person is not speak up, and different from the person is showing a rude behavior to others.
Start.
Assertive communication respects both yourself and others. It helps understand each other clearly and better. In healthcare, this is important because clear communication develops trust between patient, families, and staff. Assertive communication. Assertive communication, clear, direct, and respectful expression involves expressing thoughts, needs, and feeling confidently. Respect the rights and opinion of others. Different from passive, not to express, aggressive, forceful, or disrespectful. Promotes mutual understanding and trust. A low and calm voice tone is important because it shows control and professionalism. Active listening is also a key part. This means paying full attention to other person and responding properly. Key feature of assertive communication: clear and confident verbal expressions, use of respectful and appropriate language, positive non-verbal communication, eye contact, low-pitched voice, and open body postures, active listening and feedback, self-awareness and emotional control. Strength of assertive communications. Assertive communication. So we have 6 steps to healthy conflict resolution. Affirm others, repeat observations, your interpretations like your thoughts, your feelings like how you feel, your needs like what are you trying to explain about your needs, and alternatives like what is in your mind, what's your questions, and what are you trying to explain others. Develop trust between professional and service user, minimize misunderstanding and conflicts, encourage open and honest communication, enhances professional relationships and collaboration, improves patient safety and quality of care, favor ethical and respectful practice. Assertive communication has many strengths in health and social care. First, it helps build trust between healthcare workers and patient. When communication is clear, patient feel safe and respected.
Start.
Another strength is that it improves teamwork and professional relationships when they are working together. So it builds trust between the team worker and the professional care workers because they speak clear and a confident way to share the patient's records and all the data. Most importantly, it improves patient safety and quality of care by making sure information is discussed, shared correctly and clearly. Limitations of assertive communication may be perceived as rude in some cultures, not always effective in highly emotional situations, needs confidence individual may prefer indirect communication style can create tension if not used appropriately. Communication style: assertive, clear and respectful. Then passive, avoids presenting their needs, avoids expressing their needs. Aggressive, forceful and hostile. Then passive aggressive, indirect and resistance. Direct, straightforward. Then indirect, hiding or their feelings, like hinting. Diplomatic, like democratic. Blunt, very direct. And persuasive, aims to influence, like persuasive means influence others. Even though assertive communication is useful, but it also has some limitation. In some culture, direct communication may be seen as rude or disrespectful. It is also may not work very well when in emotional situation where patient may be seen are upset or in so much pain. It may also require a confidence and a good communication skill, which may not everyone does have. Some people may prefer indirect communication, so assertive may not always be comfortable for them. If not used properly, it can also create tension between people. Application in health and social care. Used when communicating with patients and families, helps provide clear explanation of treatment and care plans. Significant in providing instruction and advice. Useful in handling complaints and conflict situations. Critical in protecting and reporting issues. Needs to be adopted to meet the needs of an individual. Person-centered care. Helps become aware of the needs, preferences and values of individuals. Promotes patient participation in decision making. Develop trust and therapeutic relationships. Promotes individual care plan development. Provides dignity, respect and empowerment. Ways to respond and assertive communication: remain open, mirror their communication style, and then acknowledge and show appreciations. Assertive communication is very important in person-centered care. Person-centered care is focusing on person needs, cares, and values. This communication style helps healthcare workers to understand what patient wants and needs. It also encourages patients to take part to encourage their care plans. This helps to maintain and build trust between healthcare workers and patients in a care setting. As a result, patients feel respected, valued, and empowerment in their care process. Teamwork and collaboration in healthcare. Assertive communication enhances teamwork by making communication more open and clear in healthcare, helps to improve the cooperation of physicians, nurses, and medical assistants. Encourages staff to speak up about patient safety without fear. Improves coordination in multidisciplinary team (MDT) meetings. Minimize the error and misunderstanding in communication. Help reduce the impact of periphery on junior staff. Develops a culture of trust, respect, and physiological safety. Now we come to conclusion. Communication is a critical competency of health and social care practice. It enhances patient safety, collaboration, and quality of care delivery. Strengths: the positive communication, building trust and enhancing cooperation. Limitation: cultural differences, emotional situations, and misuse risk. It facilitates person-centered care by fostering dignity, respect, and engagement. There is a benefit of assertiveness and effective use of it in order to make healthcare environment safer and more professional. On the whole, it is one of the essential skills to enhance communication and build trust between healthcare workers and patients. So assertive communication is a beneficial, we can have some benefit of it, and we can have some seen error of this communication style as well. So we have to use it carefully, confidentially to describe our needs. Thank you so much.